Hello, everyone. I'm Mark Tarr, President and CEO, and this is Quarterly Connection. This quarter, I'm excited to sit down for a conversation with Andrew Baird, who heads up our government affairs efforts to talk about Encompass Health's advocacy efforts in Washington, D.C. But first, I'd like to provide a quick company performance and growth update. The fourth quarter provided a strong finish to a busy and successful year at Encompass Health. We saw discharge growth in the fourth quarter of 7.8%, contributing to overall year-over-year discharge growth of 8.3%. During the fourth quarter, we opened our final hospital of the year in Houston, Texas, bringing the year's total growth to 7 new hospitals, 6 classified as de novos, and 1 as a satellite. Between those new hospitals and expansions to existing hospitals, we added a total of 427 beds across our footprint in 2024. We also achieved impressive quality results, returning a high percentage of patients to their homes and achieving outstanding patient satisfaction scores. Finally, we hosted a successful Washington, D.C. fly-in event, which you're about to learn more about. Andrew, thanks for joining me today to talk about the Encompass Health advocacy efforts. I think probably a great place to start is why is it important for the company to have a presence and this advocacy role in D.C. to begin with?
Thanks, Mark, for having me. And it's a great question. As a leader in the inpatient rehabilitation space, we have a responsibility, and really it's incumbent on us to make sure that the messages that we think are important are carried up to Congress. There are many people who don't know necessarily what inpatient rehabilitation care is, and our expertise and just the breadth of our network really mean it's up to us to educate members of Congress and many people in Washington about what it is we do and the patients that we treat.
So given that, what is the most important issue right now that you see in terms of impact on the industry or a message that we need to get across?
Well, right now at the beginning of the administration, there's always a lot of speculation about what's going to happen. For us in particular, the topics of patient access, Medicare and Medicare Advantage patients and their ability to continue to have robust access to inpatient rehabilitation for the foreseeable future is really critical. There are a lot of changes that have happened in the Medicare Advantage program. That program has grown precipitously over the past several years. And there's a lot of changes in the Medicare program. And given that those are the age ranges of the people who we typically see in our hospitals all across the country, it's really important that we advocate to make sure that those programs continue to have robust support for inpatient rehabilitation care.
One of the most valuable parts of our advocacy, I think, is when we bring in, particularly our hospital CEOs, it could be other roles from within the hospitals or the regions, but when we bring them to Washington, it kind of give us an idea of what's involved with the fly-ins,
Sure.
what's the intent, and tell us the process that you go through to help prepare for a fly-in.
Well, I'll just start by saying, listen, me and my team, we're a few people in Washington, and we work day to day to make sure that we remain sort of like connected with Congress. But it's really our collective voice from all of our hospitals across the country and the relationships that they have with individual members and their staffs that really help us carry those messages on a broad basis. So you asked about the fly-in. This past year, we had a fly-in with about 53 CEOs from across the country. We had over 100 meetings. 32 of our states were represented. What typically happens is folks come into DC on one night. We work with them over dinner to brief them on the topics and talking points that we want them to carry forward to their congressional members the next day. It's a great opportunity for people to ask questions, familiarize themselves with important topics. Frankly, these are things that they live and breathe every single day in their hospitals. They have meetings scheduled with their members of Congress pretty much all day, typically in the range of 3 to 5 meetings. Sometimes it's just them and a member of Congress. Sometimes it's 2 or 3 CEOs meeting with a senator, for example. But they really sit there, and those are the primary, really rich, important engagements that our CEOs can have that can really only happen in person. having a phone call, having a Zoom call with someone back in the district is one thing, but being there on the Hill, we still think it makes a big difference.
Is it too early to kind of know what to expect right now in terms of changes that might be impacting post-acute care or healthcare as a whole? Or can you kind of look into your crystal ball and see what lies ahead?
It's too early to know exactly what is going to happen. However, there's one key thing that I'm pretty confident in, and that's the fact that the federal government overall, I think, is going to take on a smaller role in the future under this administration. There's a lot of talk and already some action that has occurred in terms of reducing the size of the federal workforce. For us, that means good and potentially concerning things. On the one hand, it means for healthcare providers potential regulatory relief, opportunities where we've seen in the past where you have just so much overreach from regulators that if we have opportunities and improvements that we can make on that space, we think now is a really great time to do that. On the other hand, a smaller government also might mean less spending, just less government spending in general. And as a company that, and as an organization that has a long time treated Medicare beneficiaries, government program, it is somewhat of a concern that we have to be, vigilant and watch out for what happens to the Medicare program, the Medicare Advantage program. And like I said at the beginning, making sure that those remain robust and that our patients continue to have consistent access to inpatient rehabilitation care. You mentioned healthcare in general. That's such a big topic that it's hard to just jump into and say, here's what's going to happen. There are discussions around changes to the Medicaid program. There are discussions to changes around how the Affordable Care Act would work. All big government programs that could really get a fresh new look under the new administration.
In the year ahead, we will continue to advocate for patients to have access to our level of care and expand our footprint to serve their needs. I want to convey my appreciation to our employees for your dedication and commitment to providing compassionate, high-quality care to our patients, and for helping us make a positive difference in the communities we serve. Thank you.